Welcome, everyone. Thank you all for joining us in an important and powerful conversation today. I'm Beth Hess. I'm the director of the Center for Early Learning at Groundwork, Ohio. Prior to this role, I led the literacy efforts at the Ohio Department of Education. I'm a passionate advocate for language and literacy development, and I cannot wait for you to hear from our speakers today. Few housekeeping items for our participation in today's webinar. Today's webinar is being recorded. There is closed captioning available. All participants are muted, but we encourage you to make comments in the chat box. Please use the Q&A for questions. You'll see that at the bottom of your screen. It says Q&A and has the cute little bubbles above it. Use that for questions, please. We have a full agenda. If we can't get to your request or your question during the event, we will follow up after the event. If you provide us with your email address, we can reach out directly to you. All participants will get a recording of the event and event materials sent to them via email after the event has concluded today. We bring you an impressive lineup today to discuss the foundation of early learning and the work happening here in Ohio. I'll provide some additional opening remarks, and we'll hear from Dr. Ryan Lee James, a national voice in this field, and close today with a panel made up of important voices from the Ohio early learning landscape. Today's webinar is brought to you by Groundwork Ohio. Groundwork Ohio is a committed, nonpartisan public policy research and advocacy organization formed in 2004 that champions high-quality early learning and healthy development strategies from the prenatal period to age 5 that lay a strong foundation for Ohio kids, families, and communities. We work hard here at Groundwork Ohio to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. In the fall of 2020, Groundwork Ohio launched 3 centers of excellence: the Center for Family Voice, the Center for Maternal and Young Child Health, and the Center for Early Learning. Each center has a unique priority and concentration, but provides collaborative, multidisciplinary, and comprehensive approaches to transform policy, remove barriers, and ensure all children and families are ready to thrive. This webinar is a product of the Center for Early Learning, whose goal is to transform early learning policy by removing key barriers to accessing quality early learning opportunities for Ohio's young children, improving child outcomes, and strengthening relationships between state and local agencies that implement early learning investments. We'd like to send a special thank you to our funders and partners, W.K. Kellogg Foundation and the Cleveland Foundation. Please follow Groundwork Ohio on social media as well as our presenters, and visit our website for more information. I'm going to give you a moment to take a picture of this slide. And now for the main event. I'm honored to introduce our keynote speaker, Dr. Ryan Lee James. Dr. Ryan Lee James is an ASHA certified speech-language pathologist and published author with expertise in language development, language disorders, and literacy in the context of linguistic differences and socioeconomic disadvantage, and believes that eventually all children will be liberated through language and literacy. In her current role as the Chief Academic Officer and Director of the Rollins Center for Language and Literacy at the Atlanta Speech School, Dr. Lee James is responsible for working collaboratively with a team of dynamic leaders to ensure each child on campus reaches their full potential through language and literacy. In addition, Dr. Lee James works with community-based organizations and key stakeholders to impact language and literacy outcomes for all children, especially those who have been disenfranchised by inequitable systems. Before joining the team at Atlanta Speech School, Dr. Lee James had the privilege of training and mentoring graduate-level speech-language pathologists as a member of the Communication Sciences and Disorders faculty at Adelphi University in New York, Dr. Lee James serves on numerous boards and committees for local and national entities. Please join me in welcoming Dr. Ryan Lee James.
Thanks, Beth, for that intro. I'm excited to be here with y'all today. Can you hear me okay?
Yes.
Okay, good. Just want to be sure because I'm in a different office space today. So I'm going to get going, and I just want to thank Groundwork Ohio and everyone who I've worked with to this point. I'm really, really, really excited to be here with y'all today. And I am pretty verbose. So I'm going to do the best that I can to stick to my slides, but I would be happy to hear from y'all after or, answer any questions that you may have in the chat. So let me get my screen pulled up. 1 second, don't pay attention to, okay, I think here we go. Now, Beth, just let me know that you can see my slides.
Yes, we see your slides.
Okay, great, because now I have my slides up so I can't see any of you. So I'm really excited to be here today, y'all. And I know the topic is about infant and toddler communication and the power of infant-toddler communication. But I gave my talk the title, Pursuing Deep Reading Brains for Every Child, Early Communication and Language to Literacy. And as Beth said, I am a speech language pathologist by original training. I am an educator and currently have the pleasure of serving as our Chief Academic Officer at the Atlanta Speech School and the director of our Rollins Center for Language and Literacy.
Dr. Lee James, I'm so sorry to interrupt. I think you may have turned your video off. Oh, there you are.
Am I
okay.
There? Okay. So we're just navigating technology, y'all. But thank you for that heads up. But I just wanted to say, because I'm an SLP, I am going to take a clinical approach to my topic today. SLP, for those who don't know, is speech language pathologist. So my talk is going to be very clinical in nature because what I'm hoping we can move to, not just in Ohio, but as a society, is training early care and learning teachers and educators along the continuum through high school, actually, to be more diagnostic so that we can provide individualized, equitable education for all of our kids. So at the Atlanta Speech School, we talk about deep reading brains. And for us, deep reading is a destination far beyond proficiency, far beyond literal comprehension, to a place that Dr. Marianne Wolf describes as a more analytic brain, a brain that can think critically and take the perspectives of others. We also endorse the philosophy of Dr. Gholdy Muhammad and how she describes reading and writing as a means rather than an end. So she talks about reading and writing as transformative acts of self and society. And so why am I starting here? Well, y'all know I'm preaching to the choir in many ways that what we are hoping for all children through early communication and language is that they develop reading and writing. And so I'm starting here with the destination in mind and sort of setting the stage with our perspective at the Rollins Center and the Speech School is that we are focused on something far beyond society's widely accepted definition of proficiency. And I'll talk a little bit more about that as we go on. We know that literacy is a human and civil right, but I'm calling out here that it's a right that is not yet realized. This year, we will get more NAEP data, or our nation's report card data, to see how our 4th, 8th, and 12th graders are performing in reading. So soon we'll be able to add a new column to this. But we know pre-COVID, many children in our country, majority of children in our country, had not achieved reading proficiency. This data is aggregate data across all groups and socioeconomic status, but we know that the data looks far more bleak for children who are African American or Black, children who speak English as a second language, and children who are being reared in poverty. So what do we know? Well, beyond that, the doom and gloom data, and we're going to get to more exciting news here. But what do we know? Well, we know that development happens in context and it's complex. Children are not being reared in a vacuum, right? There is all of this. There's a whole ecosystem surrounding children, babies, even before babies are born, right, in utero, they're a part of a really complex ecosystem. And so today we're going to talk about communication and language and what that means for later academic success. But we know it is not just the things that we do in our classroom. It's not just the things that caregivers do at home. There is a full ecosystem out there. And so I'm glad to know, as Beth informed me in our meetings leading up to this call, that there are state agencies on the line and there are potential policymakers on the line. And so I just want to take a pause here to show this ecosystem slide and say, early care and learning educators are doing their part, and they have been for a long time. Families are also doing their part. And so we need a full ecosystem that's going to support our child, including a fair paying wage or a living wage, including access to high quality healthcare and nutrition. So I want to call that out. So what we know is that systems, larger systems, have inflicted unconscionable circumstances on certain groups. We traditionally refer to those groups as diverse or minority groups, and we just know that this is a fact. So I'm sharing a graphic here on this slide that talks about cumulative risk theory. And the whole idea behind cumulative risk theory is that the more risk factors a child has in their life, the greater the negative impact will be on their developmental outcomes. So for example, executive function, cognition, behavior, oral language, and academic achievement. What is the good news though, in spite of this? The good news is that educators have a unique opportunity to impact children's lives and society at large. What we also know from this cumulative risk research is that high quality teaching and teacher-child closeness can really act as a protective factor to some of those indicators that I shared on the previous slide: poverty, neighborhood dangerousness, transiency. We know that teacher-child closeness and high quality teaching can really serve as a protective factor. I know some of my colleagues today will talk about early intervention, child-centered parenting, and maybe even other school level factors that have also been identified as protective. But I want for us to focus today on what is within our locus of control, and that's high quality teaching and building relationships with all kids and their families. So again, I mentioned that I want to take a clinical approach to early communication and language development. And the reason is because I believe that we've got to get more diagnostic. Why? Well, our national reading data tells us that we have to do something fundamentally different for all kids. And we know that in early care and learning, that means high quality, language-rich environments, or a language-rich ecosystem, as we like to talk about at the Rollins Center. And we know once children enter kindergarten that needs to look like evidence-based structured literacy. What else do we know? Well, we know that access to intervention has become an issue of equity, that children who identify as Black, Hispanic, English language learners, and children from socioeconomically disadvantaged backgrounds are actually significantly less likely to be diagnosed with speech language impairment or specific learning disability. So what does that mean? There's been a lot of conversation. I remember when I was in my undergraduate program, we talked a lot about overrepresentation of minority students in special education. We know now that minority children or children from low SES backgrounds are overrepresented in EBD or emotional behavioral disturbances, but underrepresented in speech language impairment and specific learning disability. Those two categories that would grant them access to rigorous intervention. This is true even in Part C of IDEA, that governs early intervention 0 to 3. So I want y'all to think about that as we go through this presentation, because we often talk about pediatricians being the first line of defense, to say, wait a second, we think there's some developmental delays going on here, to be able to get a child a referral to early intervention. But what is also true is that our early care and learning teachers can also be that first line of defense. So what are you seeing in your classroom related to development that might signal you to have a conversation with the family around getting that process started for early intervention? I have this other graphic here on the slide. We know that understanding what language disorders looks like, or what reading disabilities looks like in different populations, becomes really complicated, because, for example, some characteristics associated with children growing up in lower SES backgrounds, that they may enter school with less academic vocabulary. Well, if you think about vocabulary as a clinical indicator, children with language impairment or reading disability may also have limited vocabulary. And so what's been a challenge for practitioners is really parsing these things out, but also understanding that you can speak a second language, you can be from an economically disadvantaged background and still present with indicators of impairment. And so that is our challenge. So I introduced this idea of deep reading brain construction. How do we conceptualize deep reading brain construction? At the Atlanta Speech School and Rollins Center, we think about it in these 3 big buckets. This preparation phase, beginning in the 3rd trimester of pregnancy, when we know a fetus's auditory channel comes online, right? It's that early sound awareness of their mom's voice in utero that ends up turning into phonemic awareness and that metalinguistic skill that is foundational for reading. We also think about monitoring and teaching from pre-K to 3rd grade. So what does that look like? That looks like intensive progress, ongoing progress monitoring for all kids, not just those kids who may have indicators of impairment. And so we teach them in ways that evidence says they learn best. And we do ongoing progress monitoring to ensure that we're not missing anything. The last phase of deep reading brain construction is expanding and deepening. And we expect that that happens around 3rd grade, all the way through literacy. We talk about this continuum of oral language to written to oral. And I'll talk more about that as well. But this is how we sort of conceptualize deep reading brain construction. So gonna go through these briefly again. I know I'm preaching to the choir, but infants and toddlers. What do we know about infants and toddlers? That rapid and abundant development happens in the first few years of life. And that's the group that we're gonna hone in on today. We know through intentional interactions with adults and other children in their environment, infants and young toddlers develop the oral language skills that they need to be successful in later on. And so it is this early communication and language that we talk about as speech language pathologists as developing in context. So I have a young toddler at home. She's 1, actually she's about 16 or 17 months now. And she is starting to use some words, some proto words and some real words. But what we know to be true already is that she understands English word order, subject, verb, object. And this is not anything we've taught to her explicitly, right? Hey, Camille, okay, subject, verb, object in English. No, she understands that and will learn that just by being in an environment where language is being used. And so that's why we tell families, right? Talk to your baby as much as you can, even, and we want to encourage families to do that in their first language. What do we know about preschool and pre-K? Well, definitively, we know that early childhood education makes a difference. Y'all may be familiar with the Tennessee study, I think it was Head Start study, that sort of found that there was no difference in longitudinal results between children who had attended early preschool and pre-K and those who had not. One of the things that has been coming up recently in national conversation which I thought we had known for a long time, but in some circles seems to be new, that poor children do not need fundamentally different early care and learning experiences than children with means or children from higher SES backgrounds. So I think there has been some notion that there's got to be skill and drill in pre-K. We should do away with play and symbolic play, but that's not true. We know that all children need experiences where they can demonstrate their play skills, because we know that that's how children express their understanding of the world, through play. It's also a precursor, play, to early language. And so we know that high quality preschool and pre-K makes a difference for children. And what do we know about kindergarten through third grade, or as we like to talk about, kindergarten through literacy? Explicit and systematic instruction aligned with the science of reading or structured literacy. And we're thrilled to be partnering with Ohio, as Ohio has said, okay, we want structured literacy and high quality early learning experiences for all kids. So not going to spend a lot of time here because K-3 is not our focus today. But let's talk a little bit more about deep reading brain construction in the infant and toddler years. We know that communication and language are innate. We know that our brains were hardwired for communication and language. What we also know is that reading is not hardwired in the brain, that the language areas in the brain must be repurposed and reorganized for children to be able to read. And so you may have been in conversation or engage in conversation with colleagues around, oh my gosh, why is it so critical that we do all this intentional talking with babies? It's not just talking randomly and haphazardly. It should be intentional communication. And because we know that it is that early language and communication that will serve us in kindergarten or even pre-K, when we start trying to reorganize those language areas so that children are able to access print. So I'm showing this slide again because this is what we're focused on today. Early years, or day 1 or day 0, all the way through 3 years old. I should also call out here, as we talk about just development along a continuum, for simplicity's sake, we're adding age groups here. But we also know, and y'all may have encountered it in your careers, that there may be 8-year-olds or 15-year-olds or 60-year-olds who are nonverbal, right? Or who are still demonstrating nonverbal communication, because we know there's a really close link between oral language and communication and cognition. And so I do want to call that out. So when we talk about communication and language, what are we talking about exactly? Well, we're talking about a symbol system where words are used as representation. Spoken word is used as representation, but we can also think about written word. We know that language, for example, is rule governed. We know in English that we can, to a certain degree, predict what's coming next just based on what is allowable in English syntax. We also know that language is generative. We can create an infinite number of combinations, right? In terms of nouns and verbs and pronouns. We know that language and communication is social. It's agreed upon by a community. And so you can think of a community as a school community, right? My daughter in Atlanta started her first day today back in first grade, and they're going to agree upon a shared language in their classroom community, right? So we know that this is true for children who are coming from culturally diverse backgrounds, as we say sometimes. We know that communication and language can be verbal or nonverbal, linguistic or non-linguistic, when we think about, for example, math. And I've already touched on the spoken and written component of communication and language. I'm including this slide here for y'all because I think, and I can share these slides if anyone thinks they may be helpful to them later on. But I'm sharing this because I just want to illustrate the progression. So we talk about, as speech language pathologists and language scientists, these different stages of development from 0 to 3. So we break them up into what we call the pre-intentional stage, which is around 0 to 8 months. Again, remember, we're assigning months here just for simplicity. And we know that in the pre-intentional phase, babies don't intend anything yet by their communication, that they're pre-intentional in the sense that they may cry and coo and do these different vocalizations. What's critical in the pre-intentional phase is that caregivers, early care and learning teachers, or family members assign intentionality to those communicative acts. It's that intentionality that then develops into oral communication. It's also the responsibility of the adults in the pre-intentional phase to model and model talking, but also model serve and return. And serve and return can happen. You've probably seen it happen with young infants, that you say something and then you pause for a second and they may give you a coo or a smile or some eye gaze. That is early demonstration of infants' knowledge of serve and return. That's going to develop into pragmatic skills where children understand that you talk and then I talk, and then you talk and I listen. And then I've also included in the far right column, y'all, how should we be surveying communication in language? So moving from pre-intentional to intentional, as this stage indicates, children start to mean an intended outcome behind their communication. And this communication can be eye gaze, gestures. We know that between 9 and 18 months, we start to see those first words. And some of those words are real words and some are proto words. What are our scaffolds here? Talking, reading, singing, playing. In surveying communication and language, our focus at this stage is, does the child demonstrate functional communication, right? And we'll talk a little bit more about that. The emerging phase, 19 to 36 months, is my favorite time personally, because children start to use 2-word utterances. They've got a really robust vocabulary. They're also understanding more of what you say to them. We're still talking, reading, singing, playing, but even more intentionally in following the child's lead. And again, I've included in the right column just some things that we should be on the lookout for. What are we looking for during this stage? Production. Are children producing vocabulary words? Are we able to, by 36 months, we should be able to understand about 50% intelligible. So that's understanding what they're saying in terms of sound production. So we're looking for these things. Are children able to follow directions? Are they using gestures to communicate? If not, then we want to raise the red flag, not just to families, but also to healthcare providers, and to be able to get an evaluation for children if we feel that's necessary. At the Rollins Center, we have a free online learning platform, professional development training platform called the Cox Campus. And we're really grateful because we've got some great philanthropic partners that make our platform absolutely free to all educators, anywhere, anytime. But I wanted to highlight this developmental tracker. We created this based on the Center for Disease Control's milestone guidelines. But this is a really great tool for early care and learning teachers. It's also a really great tool to share with families. If you've got some concerns about your child's development, or just want to know, what should my 6-month-old be doing? In preparation for this conversation, I went back to my textbooks and notes from lectures and thought about, okay, wait a second, Camille's 17 months. She should have about 20 words by now. And so last night, I literally wrote out with my husband all of the words that she has. And I'm a little bit obsessed, right? Because this is my lane, but this is a really great tool that families and educators can make use of to understand beyond just language and communication, how children are developing, because we've got social emotional, we've got physical, fine motor development, and so forth. Okay, I'm moving through y'all. Deep reading brains under construction. So I mentioned that language is rule governed. No matter what language you speak, what dialect of a language you may speak, it is governed by a set of structural rules, allowable sequences in words. We call that phonology or phonotactics. Morphology, how do we combine morphemes to create meaning? And also syntax. We have a word order in English and Spanish and Italian that we must follow to demonstrate that we're communicatively competent with that language. Well, all of these areas, form, content, and use. Content refers to word meaning at the phrase level, also individual words, and at the discourse level. What's really critical and often an early indicator of language impairment that all of us should be clued into is how our children, infants and toddlers even, are using language. Are they interacting with the adults in their environment? Are they making eye contact? Are they demonstrating early pragmatics? If not, that may be an indicator for that child. So I included here for y'all a direct connection between each of the language components, phonology, morphology, syntax, semantics, and pragmatics, the direct link to that oral language domain and the direct link to their relevance for reading and writing. This table comes from Louisa Moat's text titled Speech to Print, Language Essentials for All Teachers. But again, the focus of the Rollins Center and the Speech School is thinking about construction of deep reading brains from the third trimester. So we believe that early care and learning teachers, even if you're just teaching our youngest infants, you've got to start with the end in mind, understanding how that early sound awareness is going to be directly tied to later reading and writing. And so I've included these slides for y'all because I think they're really critical in reflection, especially as we prepare for the upcoming school year, though I know early care and learning is year round, but just thinking about children coming to us fundamentally at a different place than where they've been in the past, perhaps spending more time at home, having dealt with more trauma and so forth. And we know all of that impacts the brain and the structure and function of the brain. So now more than ever, it's critical that we focus on building these early components of language because we know they're going to be critical for later reading and writing and spelling. Importantly, language and reading rely on the same underlying cognitive processes. And so executive function, working memory, flexibility, and inhibition are just a few of those skills that we know both oral language and reading rely on. So at the Rollins Center and Speech School, we talk about connection over compliance. So being in relationship with children, allowing them the opportunity, even at a young age, to make their own decisions and regulate their own behavior, because we know that those cognitive skills become critically important for the development of oral and written language. I'm looking at my time here and I'm thinking that I'm coming close to time, and that's good because I'm almost done with my slides. I wanted to highlight two practices that should really be integrated and woven into the early care and learning day for our youngest learners, as well as included at home. And so research talks about high quality read alouds and oral language. I'm calling it oral language rehearsal. I got that term from Margie Gillis, who is who's a reading scholar. And she talks about oral language rehearsal. And I've included two strategies that we lean into at the Rollins Center and the Speech School and have made them available for y'all on Cox campus. We talk about Talk With Me, and that strategy TALK stands for tune in, asking questions, lifting language, and keeping the conversation going. We also talk about the TIP strategy, a strategy for reading books with infants and toddlers. So TIPS stands for tune in, introduce the book, promote language, and summarize the book. Again, we know that these are critical strategies and things that we can do without a whole lot of effort. It just requires intentionality. Also important to highlight here, as we talk with families in the early care and learning space, we want to let families know that while we want children to be exposed to print, we know that every culture has different values surrounding traditional literacy. So it's most important, even if families are not reading to their children, or maybe the parent or caregiver themselves is not able to read, we want to talk with families about telling stories, right? Telling stories, maybe using wordless picture books, because it's all of that language input that we know makes a difference. Of course, reminding families to speak and use their first dialect or their first language. So I want to touch on, as I come to a close, our partnership with the Ohio DOE and early care and learning. So Ohio has created a credential around the Cox campus in recognition of their early care and learning teachers and how hard our early care and learning teachers have always worked, but especially their time, energy, talent, expertise that has been invested throughout the pandemic. And so this model, this credentialing model that Ohio has created, surrounds the essential elements that we have created based on research, and we call them essential elements of a language-rich ecosystem. These elements include children as conversational partners, a focus on emergent literacy, integrated teaching around an anchor book, a safe and responsive climate, a culturally responsive and preserving environment. So Ohio has created this credential in partnership with the Rollins Center and Cox campus. And so what does this look like? Well, in collaboration, your colleagues that are leading this work in Ohio said they wanted there to be different levels so that this is accessible for all. And remember that this credential, because of our partners, our philanthropic partners, this is totally free for Ohio teachers to be able to pursue professional progression within the field. So level 1, emergent literacy awareness, level 2, emergent literacy informed, and level 3, emergent literacy competent. And you can see the breakdown here of the different coursework that's required to meet the credential at each level. And so I hope that y'all will take advantage of this. I want to close by just saying again that we know that development happens in context and it's really complex. Sometimes we try to simplify it and just say, well, if parents just did X, or well, if teachers just did X. That early ecosystem slide was just a visual, but we can think about other elements of the ecosystem that impact a child's life. But without getting overwhelmed by societal systems, we know that educators have a unique opportunity to impact children's lives and society at large. So my closing tips and suggestions: let research and high quality evidence lead. What do the decades of research tell us about how to best construct deep reading brains? Implement those best instructional practices. And don't forget about ongoing progress monitoring. Please visit that, that developmental tool that we have on Cox campus. It will be really helpful to you. Also, what we didn't have time to touch on here was partnering with families. Families should be active partners in their children's learning. We're not putting this all on families. It's not just on families, but it's on us to pull families in, make them feel welcome as active partners, to maximize opportunities for all kids. So I just want to say thank you for your time. I'm going to stop my share screen now and turn it back over to Elizabeth. But I'm going to be on and off camera, so please feel free to ask me questions. Reach out to me again. I'm Ryan, and I look forward to being in contact with some of y'all. Thanks so much.
Wow, thank you so much, Dr. Lee James. You never disappoint. That was so informative, and I think everyone on the line appreciates the connection to our older children as well in this work. So thank you. I do see a question that has come through in the Q&A that I'm hoping, Dr. Lee James, you can address before we move on to our panel today. And that question is related to the cumulative risk theory that you discussed at the beginning of your presentation. And the question is from Erica, and she asks, is the cumulative risk theory related to ACEs? How can we connect those two ideas?
Sorry. That's a good question. And, you know, I have some other colleagues who are joining who may have more familiarity than I do. I don't know if ACEs is directly tied to cumulative risk, in the sense that I don't know that the development of ACEs was informed by that exact theory or framework. So I don't know that I can give a specific answer to that. What I can say, though, is that there does seem to be a connection, right? Like, what are some of those early risk factors, and how do we already anticipate? Because so much of this is about prevention, right? So we've got, you know, an extant literature that tells us what some of those early risk factors can be even before a child is born. So for example, you know, fetal alcohol syndrome and, you know, all of these things, we know that there are risk factors, and we know that those risk factors are closely tied to later achievement. And so I think we can certainly draw the connection and say, really ask ourselves, how do we take what we know about early indicators or early risk indicators and already put some prevention in place for our kids that we know may need it? They may not, but they may. And what we certainly know societally is that it is much cheaper to engage in prevention than it is to engage in remediation or intervention later on down the line. And as an SLP, I've seen so much of this in my work as an early care interventionist, the true positive impact that early intervention can have for all of our kids. The challenge is that we've got to get our kids access and qualified. And so that's some of the research too that I was presenting, that what we're seeing for various reasons, lack of access to high quality healthcare, maybe language is a barrier. English isn't my first language, but there are several barriers that are preventing our youngest learners from accessing early intervention. And some of those barriers, I should note, are barriers that well-meaning folks put in place. We don't want to over-refer. We don't want to say just because a child speaks a second language that they're behind. So that's why I'm challenging all of us to be diagnostic. Okay, that was a longer answer than you asked for, but I hope that sheds some light.
Thank you for that, Dr. Lee James. Okay, we're going to end with one last question. And this is a broad question about the Rollins Center and the Cox campus. And Coretta is wondering, does the Cox campus have any research or professional development around how community violence impacts development of young children?
Great. And I saw the other question too from Ellen. Ellen, I just want to say, go to coxcampus.org and create a free account. You'll be able to download everything that I shared in terms of strategies. You'll see all of the coursework, and then we've got at least, I think the recent count was 775 resources on Cox Campus. instructional resources, assessments, all kinds of things for early care educators, story guides, any book lists. So I encourage you to do that, and let me know if you have any questions, because I'll be on. So Coretta, neighborhood violence and its impact. We have partnered with Dr. Renee Boynton-Jarrett and Dr. Nina McConaughey at Boston Medical. They are pediatricians, both of them with expertise in trauma. So we have created a short course on Cox campus that speaks to some of the trauma that our children and families experience and how that trauma can impact the learning process. This course is a short course. I think it's about 30 minutes, but it provides educators with, just like I think maybe 3 or 4 takeaways that they can implement in their learning environment. So the short answer is yes, trauma-informed practices. And if you just go to Cox campus, hover over the top where it says coursework, you'll be able to access the trauma-informed care content. Thank y'all so much for your time.
Thank you so much, Dr. Lee James. And for all of our participants, we'll be sure to share all of these links in the show notes that will go out in our recorded webinar email, probably tomorrow, maybe as late as Monday morning. So we'll get you all those links as well as this recording. I also see the question in the Q&A around screening, and I think that our panel will get to that question, and if not, we'll bring it back at the end of the webinar today. So hold tight, Dawn. I would now like to transition us to a discussion with an esteemed group of panelists, of folks who are engaged in the work here in Ohio. I'm going to let them introduce themselves, but quickly you can see we have Amber Fridley, Raya Anderson, Tiffany Madden, and Shawna Benson. And I'm looking to my team here to see if everyone's videos are working. I see Raya. Let's see. Good morning. I see Tiffany, Shawna. All right, we can get started. So first, let me introduce Amber Fridley. Amber is an has been in early childhood education since 2006 and is a master teacher at the A. Sophie Rogers School for Early Learning at the Schoenbaum Family Center at Ohio State. Amber, go ahead and introduce yourself. Nope. Amber might be having some trouble getting her mute and video off. I'm going to give you a moment to work on that. And let's hear from Raya Anderson. Raya is a family ambassador with Groundwork, Ohio. Raya, let's see if you can get off to introduce yourself. I see you there.
Hi, everyone. My name is Raya Anderson, and I am a parent of a wonderful 5-year-old named Amir. I've been active in Groundwork, but also in Ohio for Head Start Family Ambassador, and got to speak in Washington, D.C. in January of 2020 about the importance of early childhood education and development and the difference it made in my child. Amir was born addicted to drugs and alcohol through his birth mother. I've had him since 2 months old. And I know personally the communication with your early childhood teachers, that's what led us to discover Amir had some delays and get him early intervention. And I'm very happy to say with all the years of work with those teachers, he's now ready to start kindergarten, and he's starting kindergarten on a 1st grade level already. So the work is really important to me. The passion of early childhood education is important, because if it can work for my son, it can work for all of our children. And it's really important that we work together as parents and people in education, work with our legislators and everyone in Ohio so that we can have an impact, a positive impact in all these children's lives. And I'm happy to be a part of the panel today. Thank you.
Thank you so much, Raya. Next is Tiffany Madden. Tiffany is the Comprehensive System of Personnel Development Coordinator at the Ohio Department of Developmental Disabilities. She's a speech-language pathologist and previously in her career served school-age children as well as infants and toddlers through Ohio Early Intervention. Tiffany?
Thank you so much, Beth, and good morning, everyone. I am thrilled to be a part of this conversation. As the other presenters have shared, early childhood, early intervention are definitely passions of mine, and I have supported children, young children and their families for 20 plus years. In my previous role, as Beth mentioned, I served as a primary service provider on an early intervention team, and I helped parents as well as caregivers, early childhood educators, help them implement strategies for communication development, as well as enhancing strategies for enhancing other areas of development. And then in my current position as personnel development coordinator for Ohio Early Intervention, primary focus of mine is ensuring that we have personnel in sufficient numbers to support all families involved in Ohio Early Intervention, and that personnel is highly trained and qualified. So thank you again for having me.
Thank you for being with us. And our final panelist will be Shawna Benson. Shawna is the Program Director of the Teaching Diverse Learners Center at OCALI. Shawna is a fierce advocate for equitable opportunities for children, is a member of the state's literacy team, and is a contributing writer to Ohio's plan to raise literacy achievement. Welcome, Shawna.
Thank you, Beth. It's so nice to be here. Welcome, everyone. So I'll just share a little bit that the introduction was very flattering. Thanks, Beth, for that. I'll share a little bit more about OCALI, our work more globally than just my center. So in my work, I do focus a lot on universal access for all learners with all types of disability and access needs and things of that nature, and communication being one of those challenges that's central and kind of near and dear to my heart, to make sure that all children, no matter their age, do have access to communication and everything that their peers have access to in the home and in the community. In addition to my Teaching Diverse Learners Center at OCALI, we also have centers that support individuals with disability, an autism center, a center for the young child, family and outreach center. We do have an office of policy at OCALI. We are a birth to earth agency, so infants through adulthood. And so we do have a lifespan and transition center, a universal design for learning center. And we also support learners specifically with sensory disabilities through our outreach center for deafness and blindness. And then kind of universal, our access center for assistive technology and accessible educational materials is also very passionate about making sure that all individuals across their lifespan do maintain access, not just gain access from early childhood, but also maintain access throughout their life as well. So I appreciate you inviting us to the table, and hopefully we can contribute some information that expands our thinking about communication access that really includes all manner of diversity.
Thank you, Shawna. And I think Amber has been able to turn on her camera and can unmute. So Amber, go ahead and introduce yourself.
Hi, I'm Amber. I work at the Sophie Rogers School for Learning in a classroom for 6 weeks to 3 years old. I've been here since 2014. We really focus on like literacy in the classroom, communication, and just providing the right resources for children to grow and thrive at our school.
Great. Thank you so much for being with us, Amber. And we're going to just jump right in and get started with our first question for you. So don't get too comfy there. And so our question, Amber, that we'd like you to address for our participants today is, as a classroom teacher for infants and toddlers, how do you see communication and language development in the children you teach impacting their social and emotional development in the classroom?
Well, we know that we use communication every day, and that with communication, it helps develop the lifelong skills of social and emotional development. We see this with just communicating with the children. A lot of things that we use with communication are things such as like labeling emotions. So instead of if you see someone crying or sad, trying not to dismiss that feeling, not using those "you're okay" phrases, but turning it back into a question. I see that you're really sad. Are you okay? And making that child feel valued in the moment. Another thing that we really focus on in our classroom is serve and return. We use serve and return with all ages, even if they're not using verbal language yet, making sure that you use that eye contact, giving a couple of seconds for the child to respond back, even if it's with a sound or a yawn, just making sure that you're like being aware of those emotions and body language that the child will give. And the last thing that we do in our classroom a lot is narrating the scene as it's happening. Just using intentional language, really being focused and engaged with children at their level as they're using like ideas in the classroom. So if they're not quite talking yet, making sure that you label what's happening. So if they're stacking blocks, you could highlight, oh, you stacked the red block on the blue block. What are you going to do next? And just giving that language that they're listening and building on those skills. And then they will take that into a lifelong skills that can develop friendship, labeling emotions, and expressing needs as they learn throughout the day.
Thank you, Amber. And I want to share that Amber sent me a wonderful handout yesterday to share with all of you when we send our show notes and recording that have some of those ideas and examples that you can use with the children that you interact with each day, whether they're your own children, your grandchildren, or if you're an early care and education provider. Okay, I'm going to invite Raya to join us for this next question. And remember, Raya is a family ambassador for Groundwork, Ohio. She's a member of our Family Action Network. And Raya, we're wondering today if you can share, how equipped did you feel as a parent to support your child in his communication and language development as an infant and toddler? What helped? Are there any supports that you wish you had?
Well, hello again, everyone. When I first received Amir at 2 months old, he's my first and only child. So I was a little like a duck out of water. He started with early childhood education at 6 months old at a Head Start center. And they knew his background. We both knew his background with his parents, and that some things might develop, some delays, or, so we were all on guard to kind of watch to see how he was developing. I felt very equipped and very supported because the teachers at the center were the first ones at about 1.5 years old that started noticing some delays in his communication and his speech. Also, they noticed some behavior concerns with him as well. And what was great about that is the way they discovered it, but the way they communicated it to me. We had a meeting together with the teachers and their supervisors and myself, and they discussed what they were seeing. And we came up with a game plan of how we could help Amir and get him early intervention. So he started certain programs, at 1.5 years old. And I was a little hesitant at first because I'd never dealt with this, but they reassured me the whole time that it didn't label my child, that we were doing this all to make sure he had the brightest future possible. And that's important. So I felt very equipped and supported, but had they not used the proper language and come to me in a certain way as a parent, I could see how a parent would put up a wall thinking that someone's just labeling their child as bad or delayed without really explaining, we know this has happened, it's no one's fault, how do we fix it? How do we come together as a team to give Amir the best future possible? So we started him in speech. He started in play therapy. And those skills really started to develop. And now I can say he's about to go to kindergarten, and I'm super excited. And he's on a first grade level going to kindergarten. And it's because of that early intervention. It's the early speech. It's the early play therapy, that helped. Are there any other supports I wish I had? I can't really say that because they supported me through the entire thing. They kept giving me referrals and information. We had to switch pediatricians and they gave me a referral because my pediatrician wasn't hearing me. It wasn't listening about these delays. He kept pushing it off as, we'll wait till he's 3, we'll wait till he's 4. But the truth is, there's so many things we can do for children earlier than that. Something as simple as play therapy, just so he could learn how to express his frustrations with the language barrier he was having. The early onset speech with sight words and sounds, that made all the difference. So I know if that works for my child and worked for my child, where he's now going to kindergarten and is going to be successful, he still has things to work on, but I can't imagine if I didn't have that early intervention, if the teachers hadn't communicated with me and gave me a support system. So it makes all the difference in the world. And one of my purposes in life now is to make sure every parent has that every parent finds a way to communicate with their early childhood educator to find the best ways possible to help their child. It's important for parents to let down those barriers, that no one's blaming you, but we parents accept that we're here to help and be able to accept that help. And it all starts with the communication from the early childhood staff. And I can say in my experience, it was amazing. And I want that for everybody.
Thank you, Raya. I think probably everyone on this call is in your amen corner right now saying, yes, we want that for everybody. And you have such a beautiful story. And thank you for sharing that with this group.
Yes, thank you.
Well, nice transition to thinking about early intervention, right? So Amir was a proud participant and recipient of that early intervention, and it's really a success story. And so Tiffany, we have heard a success story now already from Raya, but can you share a story or two that showcases the impact early intervention and communication and language development can have on later health and learning outcomes for children?
Sure. Yes. And Raya, your story was so touching, and it's nice to hear that all of the hard work that we all do just really does make a difference. So, but yes, there is one story in particular that I can think of that really impacted the trajectory of one particular child. One of our local EI programs received a referral for a 2-year-old who was having communication and behavior concerns. So the early intervention team completed the evaluation and assessment with the child and the family, and the child was eligible for services and began working with a developmental specialist. The developmental specialist, because of the age of the family's home, strongly encouraged the family to have the child's blood lead level tested. And lo and behold, the family followed through, had the medical testing done, and the child did have an elevated blood lead level. The early intervention team supported the family, provided them with community linkages and resources to get the lead mitigated in the home. They were linked to nutrition services so that diet recommendations could be made to help reduce the impact of the lead on the child's system. And then the early intervention team worked with the family and helped them implement those strategies that were going to increase communication skills and increase positive behavior. So health, learning, all of those areas were impacted in this situation, and the child's development took off. So that is one strong example of how early intervention can support, and also cross domains, health and development wise.
Thank you, Tiffany. That's a really powerful story. And I think oftentimes people want to silo the development of children, but we know that all of this is connected, and those comprehensive supports from early intervention are so necessary. Thank you. Okay, Shawna. So Shawna shared that she is a program director at OCALI, working to support children and families with autism and low incidence disabilities. So Shawna, can you share a few effective strategies in developing communication and language skills for young children with complex communication needs?
Sure, I would be happy to do that. I'm happy that other members of our panel and the presenter today talked a little bit about the multiple modes of communication, because this is a really important factor in determining other strategies that we can potentially use in that reciprocal exchange, that back and forth communication exchange that happens universally, whether we're in the home or school or community or wherever. And so just thinking about communication being multimodal, we know that sometimes, of course, children are taking in our communication, whether it's facial expression, gestures, our voice. And I know we heard a lot about talking more with students, and that's a common practice. We want to engage more with children and our infants and toddlers particularly. But beyond talking more, we also have to think about how can we express ourselves in other ways more often, and even pair our communication, our talking, with other aspects of language or communication development, such as signed languages paired with our talking, or pictures paired with our talking, gestures paired with our talking, icons or objects that we have paired with our talking. Sometimes our children's first language, or their receptive and expressive language, may not be the same language that's used in an L1 in the home. And so that puts a little bit of a twist on this communication, this reciprocal exchange back and forth. If the child doesn't necessarily hear the parent who's talking, we clearly need to communicate in a different way, where we may need to add in more signed language paired with our talking communication, or visual supports for our language, whether it be gesture or icon or objects, things of that nature. So when we're sharing stories with children, if we're sharing a book with a child, or just sharing an experience with a child, really engaging with them in that multimodal communication. And then when we pause and we offer that wait time, we also have to have tools in their environment that they can use to express themselves back in their first language, or in the modes of communication that work best for them. And again, that could be an object that they're picking up and showing you, or it could be a gesture that they're offering, or if they're starting to learn formal signed language, they could offer that. They could also pick up an icon or a visual support from an array of choices that you may have there. So making sure that multimodal communication access is available to the child in their environments, at the table, in play areas, out in the community, in the car, wherever we're at, those kinds of communication supports need to also be available in those exchanges and interactions. When we have learners who have visual challenges, or they may have visual barriers to, and I can't express how visual sometimes our language is. I think we primarily think of it as oral and auditory, but our language is very visual as well. And sometimes for students who are blind, or who have visual impairments, or maybe deafblind, have dual sensory impairments, we may need to also offer tactile exploration as part of language exploration. And one of the strategies that I would encourage families to use would be offering your hand under the child's hand and letting them kind of go along with you. If students or children are tactily defensive, sometimes they're leery of tactile exploration. So we may have to help them with that exploration with hand under hand supports as well. So there are lots of different layers that we can kind of add into our communication and language. And that interaction, we're making sure that has a reciprocal opportunity where we pause and really are expecting to see the child engage with us in some way, whatever that mode is, and then we acknowledge it, whatever mode they've chosen. And we do have a couple of videos. I know we were having some technical difficulties with audio a little bit. I think we'll play one of the videos, but there will be another video that you'll have in a set of resources that we'll share as well. And this video is just an example of one of those very early interactions between a grandmother and a granddaughter. And this particular interaction is in signed modes of communication. And you can see the grandmother doing some modeling here in addition to her voice. She's actually also kind of modeling the hand gestures. And you can see the little girl starting to kind of reciprocate using those gestures as well. I can't emphasize how important that early language is for little bitties who are really trying to begin their communication. Thanks, Beth, for playing that.
Thank you, Shawna. And there is another video that we're going to send out in our show notes, as well as that video that you just saw, to see some of these strategies in action for children with complex communication needs. Okay, we are going to offer a question now to our full panel. And I think just for the ease, we'll round robin through the same direction we went the first time around. So what is one thing you want participants of this webinar to take away with them regarding the power of communication and language for infants and toddlers and its impact on learning and health later in life? And we'll start with you, Amber.
I think the biggest takeaway for me is just that to remember that like children are learning through all stages, that they learn best through play and like they show expression through play. Also, just like communication is so important at such a young age. I think so many people feel so silly talking to like newborns and infants, but just really important to remember like that they're like taking in all that knowledge as you're speaking to them. And also just like reaching out to your village too, knowing your resources. As an educator and a parent, knowing that like I can come to my childcare teacher and ask for resources, but also as an educator, I can ask parents what they would like from me as well.
Thank you, Amber. Raya, what's the one thing you want folks to take away today?
The one thing I want people to take away is the importance of that communication with the parent. Because without the parents' help and working with that child at home, just them being at the center or the early childhood education center facility is not going to be enough. We have to be able to get through the parents, to get them on board so that it's a team effort to enhance the communication of younger children and toddlers. We have to break down those barriers so parents feel very comfortable saying, this is what I'm seeing at home. I need help with this. Or are you seeing this at school? How do we do this together? That's the piece that was so important to me, because the power of communication is not just for the infant and toddler, but it's for the parent. The way you approach the parent is either going to get them on board or push them away. And everyone's goal at the end of the day is to best serve the child. And the way we have to do that is we have to get through to the parent. We have to bring everybody on board. So that's what I would like everybody to take away is the language we use with parents and the way we discuss the language and the impact of infants and toddlers is important. So it's positive so that everyone can be on the same team so that we can get the child where they should be. Thank you.
Thank you, Raya. And I'm going to pass over to Tiffany, but I know, Tiffany, you have some slides here you want to share with the audience as well.
Yes, thank you, Beth. So I think a reoccurring theme that that I would like to stress for all is that communication crosses all domains, and we are working on it prenatally. When we focus on communication skills and we model and we talk to our babies, we're teaching them cause and effect. We're teaching them, if I signal to my important adult, and that important adult receives it, that's how I get my needs met. So that's cause and effect. We're teaching them that language is a symbol system, that things in their environment have names. We're teaching them to regulate their emotions, again, which all relates to social skills later on down the line, reading and writing. So it is important to focus on this early on. And expose children to language-rich environments. Also, just want to stress that intervening early is important. Those first 3 years of life have the greatest opportunity for that strong brain development. So we want to do all we can during those first 3 years of life. And if anyone listening has a little one in their life who they have questions about development, Ohio Early Intervention has provided this free resource online. It is a developmental screening tool called Ages and Stages. Parents can go to this link and access the developmental screener, share the result, and then we have some professionals at our central intake and referral center that can help interpret the results and take a referral to early intervention if parents are interested in doing so. So that's another tool similar to what was discussed early on that the Cox campus has accessible, but this one is specific to Ohio parents. And then if there are parents or childcare, early care and education professionals who are concerned about a child, and you already know you have concerns and you want to move right to evaluation and assessment, you can go online and fill out a referral form, or you can call 1-800-755-GROW. And the intake coordinators will help you navigate the process of evaluation and assessment. And these services are, early intervention services are for children birth to age 3.
Thank you, Tiffany. And we'll share all of those resources again in our show notes with the recorded webinar. And Shawna, what's one thing you want folks to take away today?
Well, I love all of the panelists' responses. Those are definitely high priority items. The one thing that I would add to that would be just be very open and flexible about the communication modes that children are presenting and that they may need in order to receive language. So just be thinking about how are they interacting with their world? What types of other methods or materials may I need to add to traditional spoken language in the home environment or classroom environment? And just being very thoughtful about making sure that the resources, the tools are available and that we're modeling using those tools. So part of language, of course, is that we're speaking and children are seeing us model and they're mimicking what we do. And so even though we may have traditional verbal language, we also need to model the modes of communication that our children need to start to learn in order to enhance their communication. So again, just that openness that communication is very diverse, it's multimodal, and there may be unique communication modes that we as families and educators will have to learn in order to ensure that our child has access to communication and language for a lifetime. So that's what I would add to all the amazing comments from before.
Thank you, Shawna, and thank you to all of our panelists. We have a moment or two to take a look at some questions that have come in. Let me see. We have a question. Let's see if any panelists would like to take this one from Joan. She asks, when you're planning family engagement programs and wanting to learn more about their literacy environments and habits at home, their strengths and challenges, how would you frame questions in a survey? This might be a good one for Amber.
I would say like the best way is just reaching out to parents and asking them like what their expectations are from us. And then also just giving them resources about what we expect to happen in the classroom. So I don't really necessarily think we'd send out a survey. We would just kind of contact them or have a verbal conversation of just like, here's what we're planning for the month or the week. And then ask like, what more do you want to see? And then figuring out a way to tie in that into the classroom.
Thank you. That personalized communication. I'm a parent of young children. I always appreciate that.
Can I just add?
Yes.
Beth, and anytime you're planning a survey and wanting to know more from families, try to keep your questions more open-ended, and that helps with that whole suspending judgment piece, because if you're asking a yes/no, parents may get the impression that you want them to answer a particular way. So just try to keep things open-ended.
Raya, any closing thoughts on engaging with families?
I would definitely say you have to know your families to know the best way to engage with them. I know I'm not one you can just give a survey on a piece of paper for and me probably complete it. One, I'm really busy, so who knows where I'll misplace that survey. But two, I'm a very visual, verbal communicator. I understand best by having conversation. And so it's important when you're doing these things that you understand how your specific family you're talking to, what's their best mode of communication. Because for everyone, it's different. I'm definitely an advocate for having a set of a survey, asking very open-ended questions to families, because that's one of the things they always ask me, even as we went through therapy. What are your goals? What do you see as Amir's goals? What does that look like to you? And I think those are important things. So just remember that everyone communicates differently. And so what works for one family may not work for another.
Thank you so much, Raya, and thank you to all of our panelists for joining us today. I know that you all have busy schedules and work to be doing, but this is so important, and we are just thrilled and honored that you've joined us today. I'd be remiss not to remind everyone that this week, August 9th, was named Dolly Parton Day in Ohio. And Ohio now has more children enrolled in the Imagination Library than any other state. And so we'd, of course, like to encourage all of our partners to be sure to be promoting the Imagination Library of Ohio. In this program, children birth through age 5 receive a free book every month with their name right there on the cover. And it's a great program. I know my children have loved that. I know Raya's son has engaged in that program. And so we encourage you all to be promoting that as well, and sign your children up if you haven't. We'd like to thank all the advocates and partners on the webinar today. We're hopeful this conversation gives you some things to think about and some action steps you can take in your everyday work to support the language and communication development in infants and toddlers. As Groundwork Ohio's Center for Early Learning continues the conversation of healthy development for young children, we invite you to join us as a partner and ally, and we hope to see you all soon. Thanks, everyone.
Thank you.